All right, time to round out another week of daily briefings here on Friday, May 29th. I'm J.R. Lewis on KLAM and KCDV. Glad to have you with us here. Coming off of what I feel was a pretty good talk show earlier today. If you didn't have a chance to hear that, it's on our YouTube channel, youtube.com/Cordova TV. We visited with the doctors about masks, about business walkthroughs and some of the frequently asked questions that they get. Now we are going to visit with Kathy Sherman, our public information officer for the 12th week of this pandemic event. These programs are heard in the 1 p.m., 5 p.m., and 8 p.m. hours on the radio, and then that same YouTube channel a little bit later after they air, youtube.com/Cordova TV. Kathy Sherman, always a pleasure to have you join us here. And first of all, how are you doing under the constant onslaught of information?
Well, it's always a challenge, and I guess that's a good thing. But I think everybody's happy because we had a sunny day yesterday, our highest temp of the season so far. So that always makes things good in Cordova.
It certainly does. And, a lot of businesses would be closed anyway when the sun comes out.
It was a special day.
Yeah, although it is still encouraging to see the state moving in the direction of being able to, as the governor says it frequently, living more with it than sort of under its thumb. I mean, that's a paraphrase, but, we're adapting, and Cordova continues to be smart, continues to maintain a low count. In fact, why don't we start there? What are the latest results from our local testing?
Sure. Well, the results for Thursday, May 28th, from midnight to midnight, we've conducted 460 tests. There's still one active test result. There's 455 negative test results, and 4 test results are pending. And Dr. Sanders did report the other night that we have testing capability of well over 1,100 tests. And she, at the council meeting, did comment that she feels quite confident that we'll always be able to maintain plenty of testing capability, which was really great to hear.
Well, and she mentioned, too, that she wasn't aware of any other communities, and I hope I'm not misconstruing what she said, but that have basically thrown the doors wide open for anybody that wants to get tested to be able to do so for free. Do I remember that?
I think that is correct. I do believe there was maybe a YK community this week that had a positive test that tested the entire village, but other than that, no, I think we are one of the only ones that's doing this.
And that is ongoing, although there are going to be some changes in the coming week. So let's make sure folks understand that. Starting June 1st, still testing at Ilanka and at CCMC, but at different times in the coming week.
Correct. So today will be the last day of afternoon testing at CCMC, and then starting June 1st, seems like that's a big date for a lot of things, but starting June 1st, Monday and Wednesday, you can get tested at Ilanka Community Health Center, which is downstairs right across from the Episcopal Church, and they will be testing from 1 p.m. until 3 p.m. And then beginning on June 1st at CCMC, they will be testing Tuesday, Thursday, and Fridays from 9 until 10 in the morning. So I think they've added or switched around and basically got a morning slot in there for folks that if that suits them better, and then a little bit earlier afternoon slot. So they, I think, are going by when people are coming for tests and switching their hours to suit.
Sure. Well, and adapting has been, the big
name
thing.
Of the game.
Yeah, that's what everybody is doing in practically every sector of life. So yeah, I mean, if they can serve more people more conveniently. So again, Monday and Wednesday, starting next week, Monday and Wednesday 1 to 3 for Ilanka, Tuesday, Thursday, Friday from 9 to 10 in the morning at CCMC. Same days for each facility, but different times. Different
times. And again, they still ask that you call ahead. For Ilanka, it's 424-3622. And for CCMC, it's 424-8000, because there's a little bit of pre-registration. But that was the other thing, too, that Dr. Saunders had spoken to at council was that she's so pleased that so many people are getting the test. That only adds to part of our safety.
Yeah. Well, and speaking of good things happening in the community, I think it was you that brought it up. I can't remember 100%, but this Salvation Army thing that's being offered. Dig into that a little.
Sure. So that was another report that we had at City Council this week. Heather Brannon, who is the liaison for the incident management team, works closely with the Salvation Army. And Jenny Ragland, who is with the Salvation Army in Anchorage, has been doing a lot for our community. In fact, they were able to have 2 food banks last week. But she's also participating, having Salvation Army participate in this Can Do Fund, which can offer Cordovans who are in need of assistance paying bills due to being laid off or not in work right now. All they need to do is contact Jenny, explain who they are, and then express their specific need, whether it's maybe a phone bill or electric bill, and provide some personal documentation. So I'd like to give that number out. The program's going through today, Friday, May 29th, but I believe Ms. Ragland has asked for an extension. So it's worth a call if you need financial assistance. And the number for Jenny in Anchorage is 907-339-3440. And again, that's Jenny Ragland. She's with the Salvation Army in Anchorage. It's 907-339-3440.
All right, 907-339-3440. Nice to have that as an option. Now, as you well know, in both of your roles on council and as public information officer, and by the way, let's make it clear again that as you speak to us, you're doing so in the PIO capacity, not as a representative of council. You have multiple responsibilities in these joyous
times. I got that hat on today.
Yes,
PIO.
I know. It's beautiful. The colors match your purse. The something that folks have been looking forward to, and I touched on this yesterday, is some of the public recreation facilities that have had to be shut down, maybe getting to the point that they can start providing service again. So let's go over the playgrounds again, and then there's some information about Bidarki and the pool to share as well.
Correct. So for those who don't know, Susie Hirschleb, who is the Parks and Rec director, has also been filling in as the shelter supervisor. She takes care of a lot of things when we have to call the incident management team in place. So she's been rather busy with that, but she's kind of been focusing back on getting things open for folks. And again, this is going to be June 1st, so Monday. They are opening up Cordova Playgrounds. She needs everybody to understand that you're using the playground at your own risk. The No Palace Memorial Park, which is over by the high school, there are bathrooms there and the snack shack by the field, the baseball field. So you can use those whenever you're using the playground. You can wash your hands in there, and then practice social distancing in the park or with your bubble, or your double bubble. And then also the Mount Echols Playground does not have a hand washing station, but it will be open. But we're encouraging parents to come prepared. Bring your own hand sanitizer or your disinfecting wipes. And I think most parents do that anyway and have them on hand. So just use your common sense and be responsible for your use. So that will be again on Monday, because the Parks and Rec department they're steam cleaning all the equipment and bathrooms and things like that. So getting everything ready, and they just want to celebrate the reopening of Cordova, but in the process, they want everybody to remember to have patience with their staff and getting things open.
Sure, and to reemphasize too, the at your own risk component of that is very important. So a lot of people like to maybe send kids to the parks unattended or just to keep in mind that it'd be like sending them to a pool with no lifeguard. There are risks involved in that, in not doing the direct supervision and direct management, and when there's a virus maybe floating around, just to make sure that everything's working okay. I think you're right. The parents will be doing a great job of that.
Yeah, that's a good reminder, though, and just another reason for a parent or a supervisor, to be along. I keep track of everybody I come in contact with, so you're going to want to know who your children are playing with if they're at the park, and jot down their names or keep a mental picture or take a picture. But that's important. And yesterday when we had the 13 outbreaks in the state, a good number of those are children and younger adults. So it's not like we once thought affecting just the elderly. Which I am now in the group of.
Well, I am too, technically. Well, and the thing is, now the fact that a young person is positive doesn't necessarily mean that they're going to get sick, that it's going to be fatal, or that they're even really going to show. So just to put that in context, they may not even be showing symptoms. They were just identified as a positive case. It's not like, oh, you're positive, and then they send them right to the hospital. But anybody can catch it. That's the point. And if nothing else, to have a kid at a park catch it and then take it home, and God forbid grandma lives at home or something like that. So there again, just understand that, and that's not to scare people. It's not to say, oh, don't. It's just to go into situations like this armed with good knowledge, so you can minimize the risk.
Yep.
So let's move on now to plans, which of course can always change, but for Bidarki and the pool, there's some updates there.
Sure. So I just chatted with Susie this morning, and she promised that she would try and get some information out today. So she said that the Bidarki Rec Center is shooting to open up their doors by the middle of June. So keep in mind that all the cleaning they have to do before that.
Right.
But she wanted people to know what to expect. So personal fitness will be by appointment. There's going to be no cash transactions. It'll be credit or debit only. That's becoming a norm, I think, almost everywhere.
Sure.
You need to wear a mask. She said there will be a wellness assessment. So your temperature will be taken upon arrival. There's going to be limited group fitness classes, just low impact due to the mask rule. We talked to Dr. Sanders about that too. Group sports are postponed until further notice. There won't be any showers or saunas, so come dressed to work out and be prepared to just go home and take your shower.
Sure.
They will be expanding personal fitness features into half gyms to maintain, social distancing between patrons. There's going to be 7-person capacity in the lower weight room and 10-person capacity per half of the gymnasium, and 10 square foot floor markings to maintain spatial awareness. So those are all just things she wanted you to kind of have in your head. It's going to be different, but at least they'll be open.
Yeah.
And she said that all the passes will be reactivated. You'll pick up right where you left off, having the same amount of time left on your pass on the day that they closed, which was March 16th. And then she still doesn't have a specific date set, but she is shooting for the middle of June. So we'll keep everybody updated through social media and through the radio programs.
Okay.
And then as far as the pool goes, they're working on developing plans for the pool. The pool had been set aside for harbor users to use for showers. That's not getting a lot of use, so I think they'll be moving things back. But again, the pool also will be different usage. You'll probably be the only person swimming in a lane, things like that. So
right.
She's just taking one facility at a time. So it's great that we have the parks open on Monday, and then we'll move into the rec center and then probably into the pool from there.
Okay. Well, again, it's nice to have things to look forward to have some positivity on the horizon. Of course, it's all reliant on each of us taking seriously the the fact that the responsibility has shifted to us as organization operators, as individuals, as businesses, will be able to maintain this gradual recovery if we follow the guidance and we don't do anything that causes it to spread around, because then if we have an outbreak, things are more than likely immediately going to start to just shut down again. So so it really is on us now. Any final thoughts before we wrap up?
No, that was exactly what I was going to say. It just behooves all of us, I think, to be responsible and caring and compassionate and understanding, and just enjoy being able to see people even if you have to wave through a mask.
Okay, well, with that, we will wish you the very best for the weekend, and thanks for all your hard work.
Okay, we'll talk to you Monday.
That, of course, Kathy Sherman, our Public Information Officer, as we move toward the end of week number 12 of Cordova's pandemic response. Daily briefings heard on the radio Monday through Friday in the 1 p.m., 5 p.m., and 8 p.m. hours. Note again those time changes for testing starting next week. And I'll put in one more plug if you would like to hear the talk show we did this morning where I visited with Dr. Sanders and Dr. Rush about masks, why the guidance has changed on masks since the whole thing began, how to use them, some do's and don'ts, why they're important. And then they also talked about services they're happy to offer without charge, by the way, helping businesses get ready to reopen and some other frequently asked questions. YouTube.com/Cordova TV is the place that you can go to hear that talk show and this update if you'd prefer to hear it online or share it with somebody who's not within our radio range. Wish everybody a safe weekend. Lots to look forward to on June 1st. And in the meantime, we will get regular programming back on for you on the Clam and the Eagle.